COVID-19 virus can be classified medically into 4 categories, which is mild, moderate, severe and critical. So, the treatment protocol for all 4 are different. The drugs are somewhat similar. First thing is, when it comes to mild COVID infection, the signs and symptoms include fever, cough, cold and sore throat with only upper respiratory tract involvement. That treatment protocol includes either home isolation, and the home isolation should be for 14 days, where the medications prescribed should be multivitamin, zinc, paracetamol and oxygen pulse oximetry monitoring. After that, if the child happens to have comorbidities which are in the form of kidney injury, heart diseases, any diseases with chronic lung disease or any immunocompromised state, at that point admission can be considered. If admitted, generally the course of admission is for 10 days followed by 7 days of home quarantine. After that, when we comes the category number 2, which is moderate COVID. When it comes to moderate COVID, it is the involvement of the lower respiratory tract in the form of fast breathing and tachypnea. So, if we have to classify tachypnea, less than 2 months of age, tachypnea would be if the respiratory rate is more than 60, 2 months to 1 year when the respiratory rate is more than 50, 1 year to 5 years when the respiratory rate is more than 40 and then is more than 50, and then more than 5 years when the respiratory rate is more than 40. After we diagnose the child with tachypnea, an urgent chest X-ray or a CT is important. After that, blood investigations are needed, and at this point decision should be made by the doctor. Generally, we should admit the child and start the child on oxygen, because with fast breathing the saturation tends to drop. Apart from that, we can start the child on IV antibiotics and paracetamol. IV steroids or oral steroids can also be considered based upon the severity of the chest X-ray and CT. Then comes the third category, which is the severe COVID. Severe COVID is tachypnea along with lung involvement in the form of pneumonia. So, that is more serious, and there is involvement of the chest. So, hence the child should be admitted at all costs, and the child should be started on paracetamol, IV steroids, and then remdesivir is a plus or a minus depending upon the availability and the clinical condition of the child, and then followed by which the vitals should be monitored, and any severity and acute respiratory distress syndrome should be prevented. When it comes to severe COVID, the child should be considered early ventilation therapy. The CARB protocol with early proning should be followed, and the child should be put in either non-invasive ventilation, a high flow nasal cannula, or the child can be ventilated by using intubatory techniques. Now, when it comes to severity of COVID, with severe illness, there are chances of the child having acute respiratory distress syndrome. If that happens, then the child should be definitely ventilated with the ventilatory techniques of ARDS in the form of low tidal volume at 6 ml per kg and a high PEEP. The other thing that can be done is that we need to keep doing blood tests to make sure that we rule out other forms of sepsis, we rule out shock and any coagulopathies. So, the blood investigations that should be monitored on a daily basis are COVID markers, and which include CBC, ESR, CRP, interleukin 6, ferritin, D-dimer, then LDH, and also the LFT, the coagulation profile, and the RFT. You should also make it a point that ECG is documented within 48 hours of admission to rule out any myocardial involvement. At this stage, we have to try to prevent a multisystemic inflammatory syndrome in children. After that, IVIG can only be given once it is proven to be MISC. Other things that can be done is that during severe COVID, once there is a signs of coagulopathy, you can start on injection heparin, and if there is also platelet dysfunction, you can start on aspirin. It should be continued for 5 to 14 days depending upon the severity of the illness. COVID, apart from that, monitoring. These are the only things that are required, because you need to make sure that the child is monitored at all times, because having a small body and having small weight, we have a very small window to act fast.